So we're going to page 2 in our Sims charting book. And the first thing that we're just going to talk about is there are 3 modules that make up the Sims charts. There's front office, which frequently referenced aspects of daily medical office workflow. If you're working front office, you're going to be working in the calendar a whole lot, because what are you going to be doing? You're going to be making appointments. You're going to be canceling appointments. You're going to be scheduling the drug rep that's coming in. You'll be scheduling a faculty meeting, or not a faculty meeting, a business meeting, things like that. You'll be using that calendar for everything, if that's where you're working. I'm not saying that's where you have to work. I'm just saying that's where you're going to get into that. The next thing is clinical care, and it's clinical charting for a patient record. And then the third is coding and billing, managing necessary to complete an encounter. That's where it just depends on what this kind of facility you guys are going to be working for, on how that's going to look and how you're going to treat that. But for Sims charting, these particular modules is going to take you through step by step on how you do things. When you get to your facility, if their EHR is managed a little differently, you're already going to be knowing that you're already going to know that you're going to be looking for some of the same types of things. It just may not look exactly the same. Okay, so now what I am actually going to do, Rebecca, and Jordan, y'all are not muted, so when I go to this screen, just tell me when I say, can you see this? You guys answer me, okay? Let me go. No. Oh, okay. All right, I got to do it this way. Okay, so can you guys see that this is Canvas and I've got my login information in there?
Yeah.
Okay, so I'm going to log into Canvas because this looks like what you guys do, right? Our Sims charting is found under our teal or whatever green color that our scrubs are. And then we're going into Sims charting. Sims charting for the medical office. Okay, and this is where it brings us. We're actually going to click Sims chart for the medical office one more time. I don't know if y'all's goes like that, but this is on my instructor side. And then you're going to see what you have opened, right? So you're just going to click on here and you're just going to begin to work this. I'm going to click on him just so you can see. I think some of you have already done this part. It's just taken forever today. Okay, Internet, let's go. I'm just going to go into the simulation playground because I want to go over each of those modules with you guys, even though some of you have been working with these in the EHR, and Jada's is new. And so I just want to make sure that everybody knows about some of these features. If you look on page 3, they actually start with the encoder. Now, it says encoder there, but I want you to look up here on the right-hand side that says true code. You click that. Guys, this is just how easy coding is in a medical office. We learn how to do it the hard way, but it's just this easy. So here it says diagnosis, ICD-9. We're not in ICD-9, we're in ICD-10. I'm going to go ahead and go to CPT. You see this drop-down menu? You have your diagnosis, your external causes, procedures, PCSs, then you have your procedure, well, we don't want to use those because they're 9. You have your CPT and your HCPCS. I'm going to do CPT. And then I'm going to put new office consult. Let's just do that. Do you see what it brings up here for me? What is that? It's what I have to choose from. 99241, 99242, 99243. So it's not really that hard when you're in an office and they have encoder or true coder. I want to do a diagnosis now. So I'm going to go to diagnosis ICD-10. Let's put cough. Well, it comes up R05, and then your whooping cough is this one. But then if you look down here at the bottom, it has all different things. It's actually just alphabetized. I don't really like to use this. It confuses me. But you can expand your search here. You can put, let's see, blood in stool. Then you can search all the results down here. So I would encourage you guys to get in and play with that when you can. Does anybody have any questions about this tool?
I do.
What you got?
When I open this up, because I'm in a new book, do I choose to start new and erase all the other stuff I have in there?
No, you don't have to erase anything, Miss Sue. You can just add to it.
Okay, because it says, do you want to maintain or whatever, or do you want to start a new session? So
you're going to want to start a new session.
Okay.
For example, your first one, who is he today? Nasser, the Nasser fellow?
Yeah, you know.
Taliba Nasser, because
Yeah. She's new.
so I would go ahead and start a new session for her and just follow those steps.
Because I think some of these overlap.
They
Nessa.
do.
Yeah.
They do.
Okay, that's what I'm
So does anybody have a question about true code? No.
Mine doesn't always come up.
Huh?
Mine doesn't always come up. Sometimes I have to flip through the ICD-10 choices before I get a code to come up.
Right. Well, sometimes it glitches just like everything else. I don't know. Sometimes mine takes 10 minutes to come up, but this is, thank goodness it came up today. So this is a great feature for your EHR and for our SimCharting. Okay, now we're going to take a look at, let's move to page 4. Wait, let me see. This has it all out of order, and I don't really like that. But let's go ahead. Okay, so front office, we want to add an appointment or we want to schedule an appointment. So I'm going to click that orange box. And we have to decide whether it's an annual visit, comprehensive visit, a follow-up, a new patient, urgent visit, wellness exam. You can do a block of time if somebody is going, like a doctor is going to be out for a week, and then you have an other box. So as you go through Anjada and you are doing these exercises, you're going to have an opportunity to play on all of those things. Let's see, there's a calendar. Now here, if you guys look here, you know there's a calendar, there's correspondence, and you have a blank email, you have a memorandum. If you have a patient that was scheduled but missed the appointment, you have a place to put that. And so let's just do missed appointment. I'm just going to show you that. Down here it says patient search. You can click patient search. And let's say that Mr. Where's Mr. Nasser at? I don't even have him in here. Let's use Celia Tapia.
Yeah, she's in.
Yeah, she's here.
No, I'm talking about Nasser. She's in there. You just got to type in NAS. It doesn't automatically populate.
Well, I'm just going to use Celia because she's here, so I can. So I'm going to use Celia, and I'm going to select. And she automatically, can y'all see that she is automatically generated in this missed appointment?
Yes.
Okay, we can see that. All right. So that is a neat little tool. Let's see. Go back to front office. Oh, we did correspondence. Go ahead.
I was wondering, where did y'all get missed appointments off of correspondence, right?
Yes.
Yes, ma'am. I went into correspondence.
Okay, I see it.
And then you see there's a new patient welcome. They send out new patient welcomes, normal test results.
Right.
And we've talked about this a couple of times. Patient termination. So there's already a letter generated for you there. You just have to auto-populate and just type in what you must.
Gotcha.
Then there's letters. There is a ton of letters that you have to choose from. And then phone messages. Remember when we talk about if you don't document it, it what?
It didn't happen.
That's right. So we have to document it. And again, you can auto-populate from your established patients. Next, we have patient demographics. Let's see. See, he's not in, well, maybe it's just slow. There he is. So here's my guy that I was talking about. You guys have him on number 1. See, all of his demographics is already, oh, it's a girl, sorry. All her demographics is already loaded. But what if she had an update on her insurance information? You would need to go in and update that, right? So that's how you would update. Have any of y'all played in this at length?
I have.
Yeah, I know some of you have. So and then and here's your find a patient.
Right.
Let's put me in here. Let's see, am I a patient? Go. I'm not in there, so I would be a new patient, and so I would have to have my demographics added. Does that make sense? Your demographics is simply your information. And then next we have our form repository. And this is where we're going to find our advanced directives, certification to return to work or school, like if you were out on medical leave, an authorization, doctor's first report. I'm not going to read all of these, but get in. Here's a vaccination authorization, a school physical, a referral, prior authorization request. Just there's a ton of forms there. So next, I'm actually going to go to clinical care. Let's just pick, I'll go ahead and do Nasser again. We want to select her, select. So they would actually go in, see, you would have to add allergies, but you have to do that in a specific spot. And then do you guys see where I'm pointing right here where it says super bill? They're going to put all their medical record notes here, but if you do super bill, let's see, there's no super bills for her. I thought that was really neat. But if you go to ledger, let's pick Nasser again. We're going to look for Nasser. We're going to see what's on the ledger for her. She has nothing on her ledger. She has a 0 balance. What would happen if she had a $15 balance and you pulled that up? What would it say?
It would show you the $15 balance.
It would show you your $15 balance. So this is part of the billing portion of your module, where if they call and say, I need to know what my balance is, and you could tell them. Then underneath that is claim. And every time you have, I'm just going to choose Jan here because he's first. There's no claim on Jan. When do you get a claim? When will there be a claim under this patient's name?
Once you've got it.
After the encounter, huh?
Right. You won't have a claim until you put the billing in, right? And then you put the billing in, you do the coding first. Well, the encounter happens first. The doctor gives you the medical records, the super bill, whatever it is. You code it, the biller bills it, and then once it's billed, that's when you generate a claim. So you have a day sheet portion. I want to show you something on this day sheet. Okay, so if it's the date and say it's today, today's Monday. Patient's name, I'm not going to do that. And you select a provider. Okay, so service right here. But this is what I want to show you. Do you guys see view the fee schedule? Right here.
Oh, okay.
I'm going to click that and look at what comes up. That's how much everything is. So if he came in for an office visit and it was just a well visit, it's established patient. So, and they only talk to the nurse practitioner, let's say that, it would be a 99211, and that's $24. Remember when, I know that if you don't know this is for the students who have been through it. Remember when we talked about fee schedules? Do you guys remember who decides what the fee schedule is? The doctor can charge whatever he wants. He can put whatever he wants on his fee schedule, but the insurance is going to tell them what they're going to allow him to get paid. Do you guys remember that?
Okay.
So
I
this,
do now.
yeah, this is the billing portion and coding and billing portion of it. And you guys are going to get to play in that more and more as we go along. Then we have reporting. So we're going to select our report. Do you guys remember the aging report? We talked about AR, aging report. And that's when people have not paid and we're having to do our collections. Maybe we do that at the end of the month or the beginning of the month. When you get your own EHR, when you go to your facility, this is where you would generate that report. We're going to generate by patient. I don't have any because I haven't billed anything, but that's just a way for you to see that form. So is everybody kind of getting the gist of it?
Yeah, I'm trying and I'm doing, I think, pretty good.
Right. Well, you know, it's a lot of talking right now, but as you get in and play on your lessons, it's going to become more and more clear. Okay.
Good.
How do I get back to seeing everybody now? There we go. Just takes me a few minutes, all these buttons to push. And Jada, did you kind of understand what we talked about?
Yeah, I get it.
Okay, good, good. Well, today you guys have released 1 through 5. Some of you have done that. I did a Quizlet, but some of you have already taken that little quiz. I'm going to do it a little backwards because SimCharting has it set up a little backwards. When you do your lesson, it comes with a little quiz at the back of it, I think. Take the quiz. It doesn't matter what you make. I mean, it matters, but you know what? Just do your best. What I'm going to do is when you open up Edmodo tomorrow, there will be a questionnaire, exactly what was on that quiz, so that you can see it today and answer it. Keep in mind what you don't know, but tomorrow be expecting at Edmodo to be able to have that information once again. Now today I put the answers to the first one on the first quiz there. That is a lot of trouble, especially since Edmodo won't let me put but a certain amount of words. So instead of doing that from here on out, what you're going to have is you're going to have a list of those questions tomorrow on Edmodo. And then I'll follow behind with the answers. And I'm going to do it in a document. Okay?
Okay.
That work?
And if when you do your post quiz, if you do pull out your green KINS book on page 151, it gives you the appointment types of scheduling for like a stream, wave, modified wave, double booking, open, and stuff like that, and grouping procedures and stuff. So that'll also help if you can pull out your green KINS book before you do that first quiz. It will help with finding the answers on it. And it's on 151 of this book.
That green one. Also, if you want to Google it, you're more than welcome to use your phone and Google or click over and Google. I don't know if SimChart, if you're on Canvas, it will allow you to do it. It allows me to do it. So anyway, so today should be pretty cut and dried, not real complicated. I'm excited for y'all to get on and start playing. Oh my goodness, Miss Sue, you're giving me baby fever. So anyway.
You don't even have the equipment.
All right, so does anybody have any questions? Anybody need me for anything? Or are we all good? I don't have any information about returning to school yet. I'm not real
Wish we
hopeful.
would.
I hope they know we need that information.
Huh?
I said, I hope they realize we kind of need to know that.
I know they do, and our administration would tell us, but they need to know it, and they don't know either. So they're having a meeting at 10 o'clock on Zoom, so I'm hoping that corporate will give them the information at 10. But I promise you, as soon as I know something, y'all will know. But just personally.
So will online still be an option?
Ma'am?
Will online still be an option, or it'll be just going back to school?
I would, no, it's just going to be going back to school.
Oh, shucks.
She wants to just
Don't make me come out there and pick you up and bring you to school.
Yes, while I'm doing homework, so.
Anyway, okay,
So
guys. Go ahead.
Well, now.
All right, guys. Well, you have a great day. If you need me for anything, please, please, please reach out. I don't think any of you are shy about reaching out. So I miss your faces. No, I'm in my living room now. I moved. See? I moved out of my bedroom so that at 2 o'clock in the morning, I don't get up and look at my computer and see who did something while when I went to bed. I'm like, I got to be able to rest. So have a wonderful Monday. Love you all. If you need me, call me. Bye, guys.
Bye.